right, so next what we're going to be going through is the example of how you would do bed mobility with a patient who's had a CABG, a coronary artery bypass graft. And with the CABG, there's going to be a few precautions that we know we're not going to want to do. So we're not going to want to do any lifting more than about 10 pounds. We're not going to want to do any pulling or pushing. We're not going to want to go ahead and we're not going to want to do any overhead movement. So we want to stay about below 90 degrees at the shoulders. We're not going to want to reach behind the back, and we're also not going to want to do any deep bending. Along with that, there are a few things we are going to want to do, which is when you're coughing, you're going to want to brace yourself with a pillow. We're also going to use that pillow to help us get out of bed here. So what I'm going to go ahead and do is hand Mr. Connolly a pillow so he can brace himself. What we're going to do is we're going to do a log roll here to get out of the bed. So I'm going to go ahead and pull down the covers. He already has the gate belt on from when we did a previous video, but normally the gate belt would not be on there. He does have a catheter in this case here too, and the catheter is right now attached to the lower end of the bed. So before I get him sitting on this side of the bed over here, what I have to do, haven't even touched it yet, what I have to do is make sure the catheter's up here. Again, when I'm thinking about the catheter, I always want to keep that below the level of the waist because we don't ever want anything flowing back towards the area there. So we always want to keep it below the waist. So I'm going to attach it to the bed here. So now that I've got that attached, what we're going to do, we're going to go ahead and start with our log roll here. Again, in the next video, you'll see which is going to be for a patient with spinal precautions. We might instruct them a little bit differently in that way when they're going to be able to help a little bit more. But remember, in this case here, we're not doing any pushing or pulling for this patient. So what I'm going to do is go ahead and instruct him on essentially a modified version of the log roll here. So what I'm going to do first is I'm just going to go ahead and walk him through it. So Mr. Connolly, if you'll go ahead and bend both your knees for me. That's perfect. So what I'm going to do now is go ahead and instruct you on how we can get to the side of the bed. So I'm going to go ahead and put one hand here to your pelvic area, and I'm going to get one hand here behind your shoulder blade. Now, if we were in an actual hospital, you could maneuver the bed a little bit to make sure you're doing okay with your body mechanics too, because we know that we want to bend at the knees and not at the back.
Would you put the bed rail down?
You could put the bed rail down, that's an option. So let's see if we can do that here. There we go, but one thing I want to make sure is that my IV line's not getting caught in there, so that was a good opportunity for that. All right, so what I'm going to do is, again, I'm going to have one hand here at the pelvis, one hand here behind the scapula, and then we're going to roll.
Am I helping?
You are going to help as much as you can, as long as you're not pulling.
So I'm using my upper torso or my legs.
Exactly, you're using your legs.
Okay.
All right, so we are going to go ahead and roll to your left on the count of 3. 1, 2, 3. Good. All right, so you're gonna go ahead and start to bring your legs off, and I'm gonna have one hand here at the hip, one hand underneath the left shoulder blade here, and we're gonna sit up on the count of 3. Again, you're not gonna use your arm to help push into the bed, okay?
Mm-hmm.
So you're gonna use your torso to help with that movement towards your right.
Okay.
1, 2, 3. All right, and there we are.